Hi, my name's Ashley. I'm the director of patient care at Winona. So sorry for all the technical difficulties. We had some issues on our end getting started, but without further ado, I'll go ahead and pass it on to Dr. Green.
All right, so my name is Mike Green. I'm an OBGYN, and I'm the Chief Medical Officer of Winona. And for a lot of you, I'm also your prescribing physician, so it's been a pleasure taking care of you. So a couple of things I want to say right off the bat. First of all, I'm not going to ask you for spare change. I look a little rough because I was at the hospital all night last night, and I literally just got home like 20 minutes ago, so I didn't have time for a shower or a shave. So the good news about that, I suppose, is that tells you that your doc isn't just some dude online playing doctor. I'm actually a real physician that delivers babies and sees people in the emergency room in the hospital and takes care of people in the office. So this is sort of proof positive of that. And by the way this works if you're new is please put your questions in the chat box there. And my job is going to be to answer all your questions. I'm going to monologue at first to give you a chance to get some questions in. But so start putting your questions in now so you don't have to hear me drone on. But anyway, so if I'm like half a step behind or I lose some words, I'm working on the obstetrician sleep schedule. So I do have my handy coffee in the late afternoon. Try to keep me fresh. So there's two ironic things. First of all, we kind of are a tech company, and yet we had all these technical problems getting started. So I apologize. It was a password issue, and we've got that worked out. Thank you so much for hanging in there and for your patience. The second ironic issue is that the thing I wanted to open up with today was to talk about patience. So I guess we gave you a little object lesson in that. And so, the thing is, the hardest thing for me in life, honestly, is patience, right? It's the prayer, Lord, give me patience, give it to me now, right? And so these medications, they don't work right away necessarily. I mean, some lucky few, they take their first dose and they feel great, but honestly, that's not the way it is for most people. The medicines take a while to work. And the reason is these are real medicines. It's not a placebo pill. And real medicines usually take time before they really take full effect. And that's difficult. And I understand that because, first of all, unfortunately, a lot of you have been suffering with this for a long time. And you have all these symptoms and they're miserable and they're really affecting your quality of life. And either you were afraid of hormone replacement therapy because of things that you've read online or things that your friends or your Aunt Emma told you. Or even worse, you went to your doctor and they sort of blew you off, which unfortunately happens a lot. And so you didn't know what to do. And eventually, you saw one of our ads or one of your friends told us about you and you came on and you looked at our site and you finally got the courage up to make the plunge and start hormone replacement therapy. And then, you take 3 or 4 treatments, you're 3 or 4 days in or a week in and like nothing's happening. And it's frustrating because you had all these hopes and it's like, gosh, maybe everybody was right. And this is just a dumb thing to do. And the truth is it's not a dumb thing to do, but it takes a while to work. The second frustrating thing about it, which is the part I hate the most, is that if you're going to get side effects, those tend to happen right away. But the benefits don't come on for a long time. So that makes it even worse. It's like, okay, there's all these sort of fears that you got your courage up, you did this, and now you're having side effects people warned you about, and you're not getting any of the benefits. And it's really discouraging. The good news is those 5 side effects, although come on early, they tend to go away pretty quickly. And then you kind of get that behind you. And then you start getting those benefits as they come later. So patience is really the key for this. It does work. And for most people, it works really well, but it can take some time. And there's some reasons for that. I don't want to get sort of too technical, but the idea is that you're taking a medication and that medication has to get a drug level in your body. So the problem is your body, the whole time you're taking it, is clearing it. And so it's breaking it down mostly in the liver and then eliminating it out of your system. And so it's like trying to fill a sink up while the sink's draining. And sometimes it takes a while to get on top of that and get that to the level until you reach the equilibrium. And so you get that nice steady state where the amount you're putting in equals the amount you're going out, and you've raised your levels up and now you hold that level. And that can take time. And so that's one of the reasons why it takes time, is it just takes time to get the drug levels to where they need to be. The second issue is that once you get those drug levels, then the drug levels have to work on the tissues. Now, there are some of the things, for a lot of people, there's some early wins, hot flashes, night sweats. Those don't get better immediately, but they do tend to get some benefit pretty early on, and then they continue to get better and better. Not for everybody, but for a lot of people. Sleep, sometimes you get some benefit out of that pretty early on, but some things, particularly like the vaginal symptoms or weight loss or libido, those things take a long time because those medicines have to work at the tissue level. Then the tissues have to actually change and regenerate and get back to the way they were, and that part takes time too. So not only does it take time to get a drug level, but then it takes time for tissue changes. So all those things have to happen, and those things take time, and it's a gradual process where you slowly get better and better. And so that's the thing, and it's hard, it's frustrating. It's frustrating for me as your doctor. I'm sure it's not as frustrating as it is for you, but believe me, nothing makes me smile more than when someone writes in and tells me how happy they are and medicine's really making them feel better and really changing their life. I mean, that puts a big smile on my face. And it's frustrating when it's not working for people. But I know if we just hang in there, most people are going to be happy once it starts working. So I hope that helps, encourages you a little bit. If you want, I can explain in more detail some of the science, in more detail of why it can take a while. And there is actually a third thing, and that is my philosophy is that I think it's best to be on the least amount of medicine required to take care of your problems. And so I have an algorithm that works really well. I've developed over thousands of patients that not only recommends treatment option, but also helps me recommend a dose. And that usually works really well, although it does take time. But I've purposely set it a little bit low because I'd rather undershoot your dose than overshoot your dose. Because what I'd rather is we get there and it's helping, but it's not quite helping enough, and we up it a little bit until we titrate it up till you're on just the ideal dose. I'd much rather do that than give you way too much, and now all of a sudden I'm causing problems or side effects. And so that's the way it's designed. It's designed to be on the low end of what I think you need. So not only does it take time, but sometimes we're not quite there and we need to goose that dose up a little bit. So that's some of the philosophy behind it. But hang in there. I know patience is the hardest thing, but it does work eventually. So I hope that helps, and hopefully we've got some questions now.
We have a lot of questions already. Let's start. So Victoria asked, with all the health benefits, why and when would we ever stop HRT?
Great question. And it depends. So there's always a balance in life, and there's a lot of benefits to HRT, and some of them are symptom benefits, and some of them are more the things that you're talking about are the long-term benefits, like the cardiovascular benefits for your bones, skin health, hair health, that kind of thing. And there is an argument to be made that that women should stay on this indefinitely. And in fact, there was two interesting articles last week. One came out of the UK. It's their ACOG equivalent, I can't remember what it's called, but the big OBGYN society in the UK came out saying, hey, why are you guys stopping HRT? Let people be on this as long as they need it because it's helpful and it's good. So that was their big statement. United States, that statement hasn't been made, but that came out of the UK. Hey, English women are the same as American women. Physiologically, we're all the same. So there's no difference there. There's also an interesting study. It was an early release, so it hasn't been completely peer reviewed yet. But they looked at Medicare data. So this was women over 65 that had at least at some point been on hormone replacement therapy. And they had a 20% lower mortality. They were 20% less likely to die if they had been on hormone replacement therapy sometime previously in their life. And not surprising, transdermal approach like the creams or the patches showed even more benefit than the pills, although the pills did still show benefit. So that study was a pre-release, so it's not completely peer-reviewed yet, but pretty powerful study. And again, asking that question you're asking, why would we ever take somebody off of this? And so, there's a yin and a yang here. So yes, there's benefits to it. I think some of those benefits probably wane over time. because certainly some of those health benefits stick around, but some of the other benefits may not be as powerful, like for instance, hot flash reduction becomes less of an issue as you get sort of far out from menopause and things like that. Plus, there's the expense and there's the inconvenience of having to use a medication. And then there's the problem with polypharmacy in that as we age, we tend to pick up more and more stuff and we get on more and more medicines, and sometimes it gets a little ridiculous. And so if you can pare some of those medicines back, not only does it make life more convenient, but it may be a little safer too. But there isn't any magic number of age or amount of time on hormone replacement therapy where you need to discontinue it, and it's reasonable to continue it as long as you want. I hope that answers that question.
I think it answered it great. So Yesenia asked, how long can I shower after applying the estrogen cream? I didn't see how long after applying it can she shower.
That's a good question, and I've gotten several of these online in the summer. When can I swim? So same sort of question. The cream is fully absorbed within 30 minutes of applying it. So as long as you wait 30 minutes, then you can jump in the swimming pool or the ocean or the shower or the lake or whatever. So you can bathe or get the area wet after about 30 minutes of application.
Okay. Dawn said, no questions yet, but I love Blossom. Thank you, Dawn. Lisa said, hi from Ass. Can the cream worsen fibroids?
So that's a great question. There's the answer of in theory and the answer of in practice. In theory, yes, it could. Anytime we give hormones, in theory, that could worsen fibroids because particularly estrogen can make fibroids grow. However, there's two things about hormone replacement therapy that tend not to do that. One is the dose is pretty low compared to, for instance, the amount of estrogen in a birth control pill. And so at the small dose that is necessary to relieve perimenopause symptoms, generally is not enough to feed fibroids unless you have some crazy growing fibroids. And the second reason is that we give it as a steady amount rather than, say, birth control pills where you tend to take it for, say, 21 days out of the month and then don't take it 7 days, or what happens naturally where your hormones fluctuate. And so since we're giving a steady amount, it tends to be less active on things like fibroids or endometriosis. And so it's less likely to cause that. So the textbook answer and the right answer on the test would be yes, it's possible. But the answer in clinical practice, and so what you really care about is what happens in real life, is that that's actually very rare. And it's pretty unlikely that it'll stimulate fibroids. And by the way, the same is true of endometriosis, in case somebody kind of has a follow-up. Similar mechanism.
Juliana asked, I am in perimenopause. I have mild symptoms. Wonder if I could start off by just using the HRT cream in the second half of my menstrual cycle when estrogen drops rather than every day.
So I understand the logic behind that and your understanding of physiology. It's not the way I recommend taking it for several reasons. One of the big reasons that people get symptoms of perimenopause has to do with fluctuation of hormones rather than the actual level of hormones. And so as the ovary becomes less efficient, not only does it make less hormone, but it doesn't make it as smoothly as it once did. So it kind of sputters and spits, and it'll make, something going on your side?
Yes, I'm sorry. Our house sitter came in and was trying to drag the dog out to feed her dinner, and she wouldn't leave. I'm so sorry.
Sorry. So at first I thought, am I saying something wrong? And then I'm like, because remember, I am, coming out of the hospital post-call. Okay, sorry. So not only does the estrogen the ovaries become less efficient at making the hormones, but those hormones aren't made out as smoothly. So they'll sort of produce a bunch and then they won't, and you get these little spikes. And it's these like spurting and spikes that's thought to cause a lot of the symptoms of perimenopause. And so using the medication all throughout the month is going to help dampen those spikes and keep the symptoms from coming. So it's not so much of a question of trying to overwhelm the ovary like birth control pills do. It's really coming alongside it and supplementing what the ovaries are making to smooth out that transition and keep those daily up and down spikes from happening, which is what we think, for instance, causes hot flashes. So it's really best to be on it all the time rather than do it, try to time it around the cycle. And this is a common thing. I get this question a lot online because we've basically trained you with birth control pills that's the right way to do it. But we're really after a total different thing. With birth control pills, we basically overwhelm the ovary. We give you so much hormone that we shut the ovary down, and we completely take over your hormonal milieu with the birth control pill. That's not what we're doing with hormone replacement therapy. We're just giving a small amount to help supplement what the ovary is making, not shut the ovary down. So it's really a different philosophy, and we're using it in a different way.
Okay, Kathy asks, what is the cause of acne since starting treatment, DHEA or the estrogen progesterone?
Answer is yes. So it sort of depends. DHEA can cause acne for some people. It's usually sort of an initial thing. The reason is that the DHEA basically gets broken down into estrogen and testosterone. The testosterone can act on the glands, the skin glands that cause acne. But it's a rising level, and then once you get that steady state, it tends not to activate them that way, and so you don't get that. Now, the estrogen and somewhat the progesterone, but particularly the estrogen, can also cause acne initially, but really kind of through a different mechanism, in that the estrogen can help increase skin health. It increases the collagen in the skin, but it can also sort of reactivate some of the glands in the skin and give you more youthful skin, which unfortunately one of the things youthful skin does is make pimples sometimes. So estrogen therapy can do that. It's a little bit different than the reason the DHEA does it, and it's kind of a good sign, although obviously you don't want a lot of that. And again, it tends to be sort of a more early thing, and that tends to get better as we go along. I remember as a kid one time, my aunt had like this big old pimple, and she was like, well, at least my skin's still young. So it kind of stuck with me for some reason. But it is kind of true, is that having, young, beautiful skin is great, but, young skin tends to make acne too. So.
That's exciting to look forward to, pimples again. Donna asked, will the cream/pills help with vaginal dryness, or do we need something in addition?
Great question. So they will help with vaginal dryness, but that's one of the ones that takes a while. So this is one that sometimes we don't even see at the 10-week mark. It can take longer than that. And this is one of these things in that you got to get that estrogen levels up, and then the hormone levels got to act on what's called mucosa, or sort of the lining of the vagina, because as estrogen levels drop and the hormone levels drop, the vaginal mucosa, the skin of the vagina, gets really thin and delicate. It loses its glands, and that's why it gets dry, it gets tender, it gets sore, you can get tears, sex can become painful. And so the way this works is it rejuvenates that skin, and the cells rejuvenate and they grow, and the glands sort of come back up and they get going again, and the glands start making the normal vaginal discharges that make the moisture, and that's all a great thing, but that takes a while because it takes cellular growth, it takes really changes at the cellular level to make that work, and that can take quite a while. There is a shortcut to that, and that's the vaginal estrogen creams. They really do the same thing, but the vaginal estrogen cream works right at the surface of the vagina and sort of blasts it, and gets those changes much more quickly. So if you can be patient, you can get a sort of, one shot fits everything, with your pills or your cream, and it will fix your systemic symptoms, but it will also work on the vaginal symptoms. But those vaginal symptoms take a long time. If you're miserable from the vaginal symptoms and you don't want that, you don't want to wait, you can use a vaginal cream. The problem with the vaginal cream is it doesn't really get absorbed to a great extent, and so it doesn't help those other symptoms. So it's not going to help your hot flashes. It's not going to be a mood stabilizer. It's not going to do those things. It's not necessarily going to help your skin or your hair, but it will does a great job at helping the vaginal symptoms. So if you're sort of in a hurry or you're just miserable from the vaginal symptoms, then doing both doing a body cream or a pill as well as an estrogen vaginal cream is really the way to attack that. If it's sort of annoying, but you can be patient, you can get away with just the pill or the body cream, and you can have that work for everything, but it will take a while.
Marta wrote in and asked, I'm curious about how inflammation is affected by HRT, such as, I'm going to need help with this word,
Tarsalgia, so yeah, pain of the metatarsals. So yeah, that's an interesting one, and I'll be honest with you, I don't totally understand the biochemical mechanism for this, except that I do know that estrogen particularly, but also progesterone, does work as an anti-inflammatory in the body, and it decreases inflammation. And it decreases inflammation everywhere, and so it can help all the joints and get rid of some of the inflammation in the joints. I've got some patients, honestly, there were a couple of them I was pretty skeptical that, I knew it was going to help their other symptoms, but, they were really hoping it was going to help, their terrible shoulder pain or their what sounded like arthritic pain. And I'm like, well, I hope it does. I know it'll help these other symptoms. And then like, oh yeah, I'm like, I feel great. So it does work. And it works through an anti-inflammatory mechanism. And I'll be honest with you, so that's for me to study for next time. I don't really know the biochemical basis of that, to be honest, except that I know that it does work.
Next time it's going to be really great. Keep them coming
So
back.
yeah, I try not, if I don't know, I'll tell you I don't know rather than just BS something. So at least you got that.
So the next one's from Ronnie. She asked, so I started HRT at 51, 1 year after menopause. Went 5 years, stopped for 2-ish years, and now I'm back. This time with BHRT. Is that okay? Is it still recommended for me? Is there a recommended number of years?
Okay, great question. I know we already touched on this, but it kind of brings one of the things that I recommend. So as I said before, you want to be on the fewest number of medications needed to do the job. And so for some people, they'll find that time goes on and they don't really need these medicines anymore, and they don't know it because they just keep taking it. It's not causing side effects. They feel great, but maybe they don't need it anymore. And so I recommend after a few years, 3, 4, 5 years, some random period of time, not so much random, but after a good amount of time, you might try going off the medicine and see how you feel. Do it at a time, don't do it when you're trying to, plan your kid's wedding or something. Do it at a time where it's kind of mellow, and try going off and see, it may take a month or two before you really know, but let's see what happens. And, if you find, hey, you know what, I feel the same, it's like, okay, they're probably not necessary anymore. If you're miserable, then we restart them and get you back to feeling good again. And so I think, Ronnie, what you did is a very reasonable thing. You went 5 years, tried off, okay, you went off for a while, and then you decided, oh no, I'm like not feeling good again. And so you restarted, this time with a bioidentical, which is, in my opinion, a better way to go. But in any case, you restarted, and that's completely reasonable. And then you can do that for some arbitrary period of time. And when you feel like you want to experiment again, you can try going off and see how you feel. But again, you can stay on this indefinitely as long as it's working for you and relieving your symptoms. And you haven't developed some health condition where all of a sudden it's not safe anymore. But that's pretty rare. So as long as you're doing well on it, it's fine to continue it. But it's also fine after a few years, do an experiment and see how it goes. And I think that's a really reasonable way to go.
So the next question is, just started Winona. Does it make your cycle more regular, or will it keep your period going even if it would have stopped without HRT?
So it will not keep your cycles going. So you're going to stop having periods when you're going to stop having periods. And hormone replacement therapy won't do that, at least the strategy that I employ. Excuse me, coffee's getting me now. So if you use HRT every day the way I recommend doing it, it's going to be pretty neutral on your periods. Some people, it'll mess up their first cycle, and that can be frustrating for people. So it'll throw them an extra period or make their period weird. But once they get through that sort of that first month, that first cycle, then things kind of go back to the way they would have been, for better or for worse. It may make it a little bit better, but I wouldn't hang my hat on that. It's not really what it's designed for. So this is not designed to really fix your periods or change your periods or give you a period. There is another strategy that people use with HRT where they cycle, particularly the progesterone. And there's reasons for doing this. I don't think they're great, and they end up giving people periods. And, I don't know, it's not me. And some people feel differently, but I can't imagine if I didn't have to have a period, I don't think I'd want to have a period. And so, you take somebody who hasn't had periods for 5 years and all of a sudden it's like, well, we're going to get rid of these symptoms that we're going to make you have periods again. I don't know that I'd want to sign up for that. And so using the cycling method of HRT, as we talked about before, that may re-trigger periods. And there's really not a lot of benefit to doing it that way. So I think giving the hormone replacement therapy every day, number one, it's easier to do that way. It's harder to mess up. And number two, that's not going to give you periods if you're not supposed to get periods. It won't necessarily fix your periods if your periods are bad either. But it's kind of period neutral once you get out of the first month or so.
So the next question is from Lisa Marie. It's very similar to the one before. At 57, I just had my first period in 5 years after 3 weeks on this medication.
So yeah, that's basically what I was saying. So that's not an unusual story, but it should be a one-time thing. So if it just happens, that first month or so when you first start HRT, it's nothing to worry about. If you haven't had periods for a long time and all of a sudden now you're getting regular bleeding or you're spotting all the time, that is not okay. You need to message me or your doctor, whether it's, Dr. Brown or Dr. Davis or one of us, whoever's your prescribing doctor, and let us know, because that's important information. And we may need to either manipulate around the hormone replacement therapy or ask you to get that looked into. But initial period in that first cycle, that first month, annoying, I apologize, but nothing to worry about. But if that continues, we need to know about it. The other thing is, let's say that you're not having periods anymore and you're going on with your hormone replacement therapy and everything's great, and you go away for a long weekend and you forget your cream and you don't use it for 3 or 4 days. That may trigger a period. And if that happens, that's not necessarily dangerous. So stopping the hormone replacement therapy can sometimes give the signal to your body to start a period, and that will sometimes happen. So if you forget it, like 1 day shouldn't do that, but you forget it for 3 or 4 days, you may end up getting punished for the period. So that's a reason not to forget it.
So the next question, what over-the-counter gel would you recommend for dryness?
So, yeah, that's a good question. Any of the lubricants work well. KY has a big range of products. They're pretty available and pretty inexpensive. Most of these are all made out of sort of the same stuff. They're just sort of packaged differently, or maybe they throw a scent in, or they have no scent, or they have different gimmicks. But I think KY products are pretty good, and they tend to be inexpensive and pretty available. Astroglide is another big name. They make trusted products as well. So those are a couple places to look.
So in follow-up to Lisa Marie's previous question, who asked if she just had her period for the first time in 5 years after 3 weeks on the medication, she's asked, should I keep going with my intake?
If you mean, should you keep taking the medicine? Yes. If you stop the medicine, it's going to start another period probably. So yeah, if it's just in that first 3 weeks, just keep taking it every day. And this should be a one-time deal. Again, if a month goes by and all of a sudden you get another period, or you just keep spotting, or you bleed really heavy, please message us right away so that we can give you guidance on that. But in this case, yeah, I would just keep taking it. It should stop, and then it shouldn't come back.
Marissa asked, is it okay to take every other day if your symptoms are mild or under control? And what can the additional DHEA help with? Also, why would I want the 80-20 combo versus the 50-50 combo on the bi-est cream?
Okay, so those are some good questions. There is a strategy of progesterone of taking every other day, and that works. And there are people that do that. And honestly, it's just fine to do that way. The problem with every other day is that you lose your grace. So if you're taking it every day and you forget a day, kind of no harm, no foul. You take it every other day and you forget a dose, now you're going 3-4 days without a dose, and you may end up getting side effects from that. It may trigger a period or other problems. I've seen enough pregnant people on birth control pills to know that it's really hard to take a pill every day. I'm on a blood pressure medicine. I'm actually pretty good. It's been a long time since I forgot a pill, but I go through some elaborate plans to make sure I don't forget. So it's hard to remember every day, and none of us are perfect. And so if you're taking it every day and you forget one, it's not going to punish you. If you're taking it every other day and you forget a day, it may. And you may end up with a period or having side effects. So I don't see that there's great benefit there, and there's a little downside risk. So to me, I think it's easier to take every day. It's also harder to remember every other day. So now are we talking about Monday, Wednesday, Friday? Or are we talking about 1 week, Monday, Wednesday, Friday, Sunday, and then the next week, Tuesday, Thursday? It's just hard unless you're going to start marking calendars and stuff like that. So it's a lot easier to remember something that you do every day rather than every other day. So that's another reason to do it every day. But from a basic physiologic standpoint, every other day probably works okay. Once you get that, it'll take you a lot longer to get that steady state. And so initially it's going to take a lot longer to get results. But once you get those results, that's probably enough to keep that steady state going. But it's kind of takes away your wiggle room, and it makes it hard to do it correctly. So DHEA breaks down into estrogen and testosterone. The estrogen that it makes is pretty insignificant compared to the estrogen we're giving you in the cream or the pills or the patch. And so it's really the testosterone that we're after. And so we use DHEA as a safe, gentle way of increasing testosterone without overshooting and give you a bunch of testosterone side effects. So I start almost everybody on 25 milligrams of DHEA because I found that's enough to get people into sort of the low normal or the mid normal female range of testosterone, which is pretty much where we want people. Sometimes it doesn't quite get people there, or it turns out not to be enough, and then we can double it up and push that testosterone a little bit higher. Most of the time we get away with that. So people that tolerate the 25 milligrams usually do well on the 25. Every now and then that gives testosterone side effects, and it's like, oops, that's too much for you, we need to back down. And it's sort of trial and error, quite honestly, for that. The benefits it'll give you are the testosterone benefits. So energy, libido, weight loss, those are sort of the big ones that testosterone gives. But again, if you use too much, then you start getting testosterone side effects, which are not fun. So again, there's a sweet spot where you have the right amount that's getting you where you're supposed to be and giving you nice benefits, but not so much that's giving you side effects. We're not going for the super doses here. So I've got friends in the gym that take massive doses of DHEA because it's an easy way to get testosterone in, and that's fine. Everyone live and let live. It's not what I do personally, and it's not what I prescribe. So that's not what we're after. So if you're into competitive bodybuilding, or you're a power lifter, or you're going for an athletic edge, you may want to accept some of those testosterone side effects and push the DHEA, but it's not what we're doing here. So what we're doing here is trying to get you into a normal female range of testosterone to get you feeling younger again. Let's get the testosterone level the way it was before your ovaries stopped doing what they were supposed to do, and get you feeling like you did when you were younger, and stay youthful. And that's really what we're after. We're not trying to make supermen, superwomen here. So that's the DHEA. Okay, so bi-est cream. So this is a good question, and I'm just gonna tell it like it is. So I don't think there's a big difference between the estradiol and the estriol. I think honestly they both work well, and so the ratio, whether you're doing an 80-20 or a 50-50, I don't think there's any clinical difference. There are some people that feel strongly that giving both in a cream form is helpful. Honestly, I don't know whether that's true or not, but there is some data for that. And so we went quite honestly to 50-50 because it's easier to make, it's more available, and it's cheaper than the 80-20. And I don't think there's any benefit to the 80-20. So I'm a Kirkland guy. I buy most of my clothes at Costco. If I can find it at Costco, I know it's a good value. It's like, can I use this up in my life? And so, I'm not a total cheapskate, but I'm not going to spend money where it's not going to buy me value. And I don't think there's any value to spending more money and charging you more for an 80-20 combo when a 50-50 combo is just as good. So it keeps prices down, and I think it works just as well. I don't think there's any data that one works better than the other, so you might as well pick the one that's less expensive. And by the way, here's my tip for the day. The next time you go to a restaurant and you're looking at the menu and it's like there's two things that jump out at you and you can't decide, and it's like the waiter comes and now you're on the hook, pick the cheaper one. If they both sound great, might as well pick the one that costs you less money. So that's sort of my rule of restaurants. All right, that was a freebie.
I'll remember that next time I go out to eat. Okay, so Ronnie asked another question. I had fibroids back in the day. They stopped with menopause. Will they come back with BHRT?
So yeah, I kind of covered this, but I'll hit it again. No, they really shouldn't. So that's one of the great things about menopause. Honestly, there's few great things about menopause. That's one of them is it tends to shrink the fibroids down. The amount of hormone in the hormone replacement therapy in general is not enough to reactivate your fibroids. So I actually haven't seen it happen. It is theoretically possible, but it's extremely unlikely. So no, that's the thing. It's like, gee, there aren't very many benefits of menopause, but the few ones that there are, you don't want to take away from people. And fibroid shrinking down is certainly one of them. And the BHRT should not get the fibroids growing again. So you should be okay there.
Cassandra asked, I actually have a couple of questions. When we get to be 6 years old or so, and we're no longer able to, are we no longer going to be able to get the HRT? And if so, will we have to go through all the symptoms again when we go off of them?
Great question. So there's two parts of the question. And the first is, no, you don't get cut off when you're 60. So the 60 rule is that the general concept out there right now is that we shouldn't be starting people on HRT for the first time when they're 60 or over. If you're on it before you're 60, it's fine to keep staying on it. And I'll explain the logic behind it. It has to do with heart health and cardiovascular disease. And we know that women that start HRT before 60 have a decreased risk of cardiovascular disease than women that have never been on it. We also know that if we start for the first time somebody on HRT after 60, they actually have an increased risk of a cardiovascular event the first 2 years of starting the hormones. And so that's why we don't prescribe it for the first time for women over 60. And the reason we think that happens is that because there's this benefit, women that haven't been on HRT are sort of slowly having cardiovascular problems. And so by the time they're 60, there's potentially issues there. And then we start the HRT and it sort of jumpstarts things, and that can cause a problem. If you get through the first 2 years without a problem, then all of a sudden it starts helping again. But it's sort of built up. But if you've been on the HRT since before 60, you haven't had that build up, and it's safe to continue it as long as you want to. So the 60 is sort of a magic number, and it's a little silly, honestly. I mean, being 59 and 364 days is not a different risk than being 60 and 1 day. Okay, that's common sense. It's just that you've got to draw a line in the sand somewhere, and that's where the line is drawn, and it's a statistical marker. And so if you start, well, okay, she's only 60 in 3 months. Okay, she's only 61. Eventually you start hurting people. So you got to have that line in the sand. But as long as you've been on it already, you can keep using it as long as you need. The second half of that question is, what happens if you stop it? Are your symptoms going to come back? And the answer is probably not. So if you get to a point where naturally, let me rephrase this. So For a lot of the symptoms, some of the symptoms just keep getting worse no matter what. And yes, those symptoms will come back if you stop the HRT. But for a lot of the symptoms, they tend to be bad in that perimenopause time, that transition time, what we call the menopause transition. And then eventually, after you get through menopause and some time goes by, those naturally go away anyway. So it's rare to see an 80-year-old with hot flashes. Those tend to just go away. And so if you're at that time, that stage where they wouldn't be there anymore, if you stop the hormone replacement therapy, they aren't going to come back. But there are some things like vaginal changes, for instance, that just tend to keep getting worse. And yeah, if you stop the hormone replacement therapy, those are going to come back. But the ones that wouldn't normally be there at that age, they're not going to come by stopping the HRT. Hope that makes sense.
Okay, next question is from Jennifer. My cycles have been horrible the past year and have left me bedridden for days every month. Will this help me regulate it a little bit better until I fully go through menopause?
So yeah, this isn't what you're going to want to hear. This doesn't work great at cycle control, and it doesn't work great for painful periods. It may help a little bit, but there are better things out there if that's your main problem. Now, sometimes you want to do a combination of take a medication for these horrible periods, but then also do something for the other symptoms of perimenopause. And so it's common that we'll have somebody on a medication for their painful periods and also on hormone replacement therapy for their other symptoms. But honestly, this doesn't do a great job at dealing with those really bad periods. I mean, you can try it and you may get some benefit and it may be enough to get you through. But if they're really that bad and you're bedridden, a certain amount of days out of the month, you need something better than this, quite honestly. And I would see your local physician because there are other things besides hormone replacement therapy that can really benefit you. And that just seems like a miserable way to live life. So again, this isn't a panacea for everything. It helps a lot for a lot of things, but there are some things that it's not going to help that much for, and unfortunately, that's one of them. It's not great at helping with really bad periods.
So Yesenia she said, just received Winona today, nervous, but hoping this will make a difference. I've never tried HRT, but heard it was good. Oh, welcome to Winona.
Yeah. So you're kind of the person I was talking about at the beginning of this. Because I imagine if it was me, that's how I would feel. It's like, gosh, you hear all this controversy about it. People say scary things. Other people tell you how wonderful it is. It's a little scary. And so you're jumping into that pool and seeing how it's going to work for you. And for most of our patients, they're really happy and they're glad that they made that plunge and it works. But again, don't expect that first dose to solve all your problems because if it does, it's probably psychological, but it will help. But give it time, and you got to be consistent and patient. And I think you're going to be really happy that you're going down this route because for a lot of people, it makes a huge difference in their quality of life.
So the next question is, Kylie, I'm wondering how long I'll need to take this medication. I take thyroid meds. Should I have my thyroid levels checked before I start this, just in case my thyroid meds that need to be adjusted?
So that's a fair question. And some of the symptoms of perimenopause and thyroid can overlap. I think if you have the sort of correct cluster of symptoms and you're of the appropriate age, it's probably at least partially from perimenopause. I mean, the bottom line is all women go through perimenopause if they live long enough, and you'd have to die at a really tragic age not to live long enough. So, the vast majority of women are going to go through perimenopause. And so those symptoms are going to be there. Can there be overlap? Can you get some squeeze out of your thyroid? Yeah, maybe. And it may be worth doing both concurrently. But if you're having these cluster of symptoms at the appropriate age, I can almost guarantee you that there's at least some component of it is from your perimenopause. So I would do both. I think it's reasonable to start the medications, and see how it works for you, and maybe also go down the thyroid route as well, because sometimes people have both, and you might as well maximize both things if you can. The hormone replacement therapy does not treat either low or high thyroid, hypo or hyperthyroid. So don't stop your thyroid medicine. That's really important. Even if it's got you feeling better, thyroid medicine is really important, even if you don't necessarily feel the symptoms. But if your thyroid's not functioning correctly, it's a very important organ, and that replacement is also very important. And the one doesn't replace the other, and vice versa. So if you're on thyroid medicine, you may need both, but don't just stop the thyroid medicine. This shouldn't adversely affect your thyroid. Thyroid medicine, particularly thyroid replacement, if you've been on it long enough, you know this is true, can be a tricky drug, and the doses can be fickle, and your thyroid dose can go up or down and change over time. It can be from diet, it can be from a new medication, it can be for anything. So just like everything with thyroid medicine, it is possible for hormone replacement therapy to eventually, you might need to change your thyroid dose. But I assume if you're on it, somebody's monitoring that anyway, because that tends to change over time anyway. So you do want to keep an eye on the thyroid, and adjustments may need to be made. But again, I think you can do both at the same time.
So Lori asked, have you had any patients report burning urination?
So hormone replacement therapy should not cause burning of urination. It can help fix that. So there's a lot of reasons for that. Obviously, the obvious one is a urinary tract infection, but I assume that that's already been ruled out. So there's other things that can affect that. Interstitial cystitis is one of them, and hormone replacement therapy, although not the primary treatment, can help that somewhat. Also, changes in the vaginal wall, particularly the upper, what we call the anterior vaginal wall, can affect the bladder and the urethra. That's the tube that connects to the urethra that you pee out of. And if those tissues are thin and friable and not healthy, that can cause burning with urination. Hormone replacement therapy can help that because it can help increase the health of those tissues. So it really shouldn't cause burning with urination, and if you're having that, they're probably ought to look elsewhere. But it sometimes can help that as one of the symptoms.
So the next question is from Yesenia one more time. She says, do I stop applying the estrogen patch, Clymira? Gyno prescribed me once I start this treatment.
So yeah, the hormone replacement therapy will replace your estrogen patch. If you have enough supplies, I think it's nice to keep the patch going for about a couple of weeks. I'm assuming you switch to the pill or the cream, but particularly with the cream, while that cream is getting your drug levels up. So I would overlap by 2 weeks. So the first 2 weeks that you're taking the cream, if you have enough patches, keep using the patch, and then go ahead and stop the patch after about 2 weeks. It just makes for an easier transition. It's safe to just stop the patch the day you start your cream, but I think your body will transition more easily, and you'll feel better quicker and have less side effects if you can overlap it by a couple of weeks.
Okay. So the next question is from Dawn. Do you know if the 0.1 milligram patch is equivalent to what the ovaries would produce naturally in women who are not in full-blown menopause? Making sure I'm getting enough estrogen.
So that is a tricky question, and it really depends, because estrogen levels aren't that consistent, and they actually do vary throughout the cycle quite a bit. 0.1 patch is a high-dose patch. So for women that go through what's called surgical menopause, that's where they have a surgery to remove both ovaries, can be pretty dramatic. And because you don't go through this slow, gradual transition of perimenopause. One day you've got normal levels, and the next day, boom, we've shut you off. And for those people, a big high-dose patch like the 0.1 milligram patch is sometimes necessary, and sometimes it's not enough. Sort of depending on your particular situation, your ovaries, and how much estrogen your ovaries are making, and to some extent, how healthy they were before they were removed. So that's the situation where we use a high dose or a higher dose hormone replacement therapy. And I've had patients where even that's not enough, and you've got to push it further. Unfortunately, 2 patches become pretty expensive. So sometimes mixing treatments, a patch and a pill, or a patch and some cream, is going to be the way to go if necessary. But the answer, if you're getting enough estrogen, is, are your symptoms under control? And if your symptoms are under control, you're getting enough estrogen. And if they're not, then we may need to push it.
Okay. The next one is from Marissa. She says, my pharmacist, who I get my compounding meds for my thyroid, said if I go on HRT, consuming wine/alcohol can cause other issues and increase the risk of cancer. Is that true?
Never heard of that. Consuming wine and alcohol in small amounts, there's a lot of controversy about this. It seems like every other month we get a new article. One says, oh, a glass of wine a day makes you live longer. Oh, a glass of wine a day is going to give you cancer. I don't think we really know. I think that drinking alcohol in moderation is reasonably safe. And there isn't an interaction that I know of between hormone replacement therapy, alcohol, and cancer. Now, if you're drinking large amounts of alcohol, that's going to affect your liver. And hormone replacement therapy does get metabolized by the liver. So it can put additional strain on the liver. So if you're an alcoholic, then yeah, that's not cancer, but liver problems is a potential problem. But quite honestly, if you're an alcoholic, the liver interactions with your hormone replacement therapy is probably the least of your issues right now. But I can tell you, my wife is on our Winona hormone replacement therapy, and we're not alcoholics, but we like to drink a glass of wine or have, when we're out on the lake, have a gin and tonic or a margarita. And I'm not worried about her getting cancer because of that. So in moderation, enjoy your alcohol with your hormone replacement therapy, and I wouldn't worry about that at all. I
didn't know your wife was a patient. That's so cool. Whitney asked.
Yeah, I could get in trouble for that. You're not really supposed to treat your own wife. I did deliver my last baby.
Oh, you did?
Yeah, it wasn't so much fun as I thought it would be. It was really nerve-wracking. Like, it's the only delivery I've gotten nervous for. It was a lot more fun being the dad than being the doctor, but gotta give it a try.
That's really funny. Okay, so Whitney asked, is there a benefit to adding an over-the-counter testosterone booster supplement when you are taking the estrogen progesterone cream?
So you got to understand that I'm not a big supplement guy. I know I see some of the lists that y'all are on, and some of you are like big supplement people, and that's okay. The problem with supplements, for most of the supplements, there's not a lot of data that they actually do anything, nor is there data that they're actually safe. So the difference between a pharmaceutical and a supplement is that pharmaceuticals have to go through very strict testing to prove, first to prove that they're safe, and then to prove that they actually work. And they do these big, huge tests to be able to prove to the government that, yeah, this is something that they should allow to be used. Supplements don't have to do any of that. They just can be thrown out on the market because they label them as food. So they have to be like food grade, but they don't have to be medicine grade. Do supplements work? Of course, some of them have active ingredients and they work. The problem is they don't have the same kind of regulation that pharmaceuticals have, and they don't have the same kind of testing behind them. DHEA is an exception because that is technically a supplement, and I obviously prescribe and believe in quite a bit of that. There's, for some reason or another, there's a ton of data on DHEA, and it's one of the more well-studied supplements. And I know the Winona Pharmacy, and I know where we source this stuff, so I know we're getting the real thing. And so I'm not worried that what we're calling DHEA isn't really DHEA. Whereas if you're buying some supplement, under some guy's coat in an alley, you don't know what you're getting. So I'm joking kind of, but so that's my thing with supplements. On the other hand, it's rare for a supplement to really cause problems. I can't remember. Every now and then something makes the news, but it's been a long time since I've seen one of these. So most of the supplements don't really hurt people. Some of them are expensive. It's not going to interact negatively with the hormone replacement therapy. And so if you feel like you're getting a testosterone boost from the supplement, and you like the way it makes you feel, it's probably okay to take. I don't think it's going to hurt the hormone replacement therapy. On the other hand, we're trying to dose this for you so that you don't need that. And you're spending enough money on Winona products to be able to cut back on some of these supplements can save you some money. And so there's no point taking something that's not going to help you. And again, it goes back to what I said originally. Being on the fewest amount of things you need to make you feel well is probably a good idea.
So the next question is from Sarah. She says, "Hi, if I have factor V lead-in, can I use Winona?"
Yeah, she's not going to like my answer. Yeah, the answer is no. Sorry, and it's a bummer. I always feel bad when somebody has a medical condition that isn't safe to use our products. But I'd feel even worse if it caused you a problem. So this is like my philosophy is that patient safety is our top 3, 10, 100 priority. Okay, so nothing is more important than patient safety. If I make your hot flashes go away and I kill you with a blood clot, I haven't done you any favors. And so, I hate that you suffer and that it's not safe to relieve that suffering with the medicines that we have. But, it's really easy to make people worse. And with the factor V Leiden, your risk of a blood clot is pretty high, and the hormone replacement therapy can increase that even more. And blood clots can be fatal. You can get a PE that can kill you, and I haven't done you any favors if I've done that. So I'm sorry. I apologize. I feel for you. You've been dealt a bum hand. It's not your fault. But you play that hand as best as you can, and the last thing I want to do is hurt you. So no, unfortunately, I wouldn't prescribe you hormone replacement therapy with that condition.
The next question. I'm 48 and a gyno prescribed me an estrogen patch and vaginal cream after I had my uterus moved, but I feel it's not helping. Would this help?
So maybe. It depends on what part of it isn't helping. So there's a couple of possibilities. Either you need the DHEA for the testosterone, or the dose of your patch or your cream isn't enough. And so increasing your dose or adding testosterone agents such as DHEA may help your symptoms depending on what your symptoms are. The other thing I found, and I honestly I have a concept of why, but I don't have like a great amount of science behind this. For some reason, I've found that, and I've sort of done this by trial and error, I found that some patients just do better on one type of treatment over the other. So over time, I've had patients who, we get them on a really high dose of cream, it just doesn't seem to be working. And so we stop the cream and we start pills, and boom, they're doing better. And I've had the same kind of patient that's been on pills, and we push the dose and I can't get their symptoms under control, and we stop the pills and we start the cream, and boom, they're doing better. And I don't know why that is, quite honestly. If it was always one direction, I could figure it out, but it just seems to be everybody's a little bit different, and they metabolize medicines a little bit different, and they respond to medicines a little bit differently. And again, this is where the sort of art of medicine. So we try to be as scientific about things as possible, but the human body is really complex, and everybody's a little bit different. And so there is some sort of experience, thing where, gee, I've done this thousands of times and I've found that this works. Don't really understand it scientifically, but it sure seems to help. And so it's possible that you're one of these people that for one reason or another, the patch doesn't seem to work for you, and switching you to a pill or a cream may give you benefit. And there may be somebody else who's on a cream or a pill, and switching them to a patch is going to work better for them. Don't know why, but it seems to work that way. So those are all things to think about. It may be that you just need a higher dose patch. Maybe that you need to switch you to a cream or a pill, or add DHEA or another agent. And so all those things are possible.
Before I read the next question, I just wanted to let everyone know I put in the chat that we'll no longer be accepting new questions just due to time, but we'll go ahead and answer the remaining ones. So
yeah, we started late, so we owe you some time.
Yeah. So the next one is from Christy. She says, does this solution provide estrogen as well as progesterone in the topical, or are they two separate items?
So yeah, for women that are prescribed estrogen and progesterone and are using the cream, we do have a cream that combines the two into one cream. The patch, that's separate. So there'll be an estrogen patch, and then you'll take a progesterone pill, and the pills are separate. But the compounded creams we do provide with both estrogen and progesterone. So for that type of topical, you can get both in the same cream. Every once in a while, I have somebody that wants them separated out, which is fine, but it seems a whole lot convenient to me to have them in the same cream. So 99% of the patients we put in the same cream.
Next question. Does the surface area of the cream application matter?
Ooh, that's a great question. Probably to a point. So there's sort of a law of diminishing returns. So if you try to rub it into like one little teeny spot, it's going to take forever to get it rubbed in there. And yeah, that's probably going to be an issue. So there is a surface area where it's going to rub into more efficiently. What that exact number is, I don't know. And I don't think anybody knows. And it probably varies from patient to patient. But I think, for most creams, you can kind of get an idea. If it's just staying goopy in one spot, you probably need to expand the surface area to get it to absorb. And that's going to be sort of a trial and error thing for you. I don't have a number for you to sort of, get a ruler out and mark it out the first couple times with a pen, and then kind of know where you're supposed to go. But it's going to be one of these gestalt kind of things where you're going to put it on and you're going to see how it absorbs, and know that it should be completely absorbed within 30 minutes. So that's actually a really good question, and I'm going to actually ask our pharmacists if they have a better answer for that than what I just gave you. My guess is they don't, but I'll give them the opportunity because these guys are really smart. I learned our Winona pharmacists, man, I learned a lot from these guys. They are really smart cookies. So just so you know, we've got some really good people helping us.
The next question, this is a really interesting one too. I've read both, apply in the same place every time and alternate. I like the reservoir concept and lean towards applying to the same place every day. What are your thoughts?
So I think if you're tolerating it well, putting it in the same spot has some advantages. Number one, routines are good. Kind of what we were talking about with the everyday dosing versus the every other day dosing. It's easier to do things well when you do it the same every time. And so if for no other reason than getting into a routine is a good way of getting good at something and just turning into muscle memory. You don't even have to think about it. So it makes it easier and less likely to make an error. On the other hand, I have some patients where if they keep putting it in the same spot, they get some skin changes. And in that case, you might want to rotate it around. So there's sort of pros and cons on both sides. And I think if your body does well with it in the same spot all the time, that's the easier way to go. And it's probably the best way to do it. But if you're finding that you're getting some skin changes or irritation, then rotating it around is going to be better for you.
So the next question is, what about weight gain instead of losing weight?
Great question. Yeah, early on in this, I had somebody all mad at me because they were losing weight, and I'm like, oh, I can't win. But I get it. It seems like nobody's happy with their weight. Either, we're too heavy and can't lose the weight, or we're too thin and we can't gain the weight. My study buddy in medical school was this skinny guy, and he was always trying to gain weight. He was in the gym and he couldn't get the muscle on. And I'm like, man, I'd love to give you some of mine, buddy. So this is not going to necessarily help you gain weight. The DHEA shouldn't make you lose weight if you don't have the weight to lose. DHEA really works, it increases your muscle mass. So it will help you gain lean body mass and even redistribute some of the fat to muscle. So even if you're on the low side and you want to gain weight, the DHEA can help you put muscle on. I mean, you can't just take it and eat chips and watch TV and put muscle on. But it'll make your time in the gym more efficient. So if you're trying to gain lean body mass, the DHEA will help you. On the other hand, it's not going to sort of fatten you up. So if you're trying to increase, your fat content, because you like where your body looks better when you have a little bit higher, fat ratio, and I get that everybody has sort of different ideas of what they want their body to look like. It's probably not going to help that. I don't think it's going to completely hinder it either, but it's not going to help there. And that's honestly, that's a really tricky one to do, to do it right. And you're really going to need somebody that knows what they're doing to guide you with your diet and exercise if your goal is to try to increase your fat content. to sort of push your curves and that kind of thing. And everyone wants to sculpt their body a little bit differently, and there are ways to do that with exercise and diet. This isn't really going to help with the fat content, but it will help with the muscle mass.
Okay, so the next one is, every time I've changed my patch, I've noticed my side effects worsen, like bloating, breast tenderness, and after a day gets better. Is this normal?
So what's happening with the patch is that they're supposed to be designed to give a steady amount of hormone through the entire 2 or 3 days that you have it on your body. But the truth is, it's not going to be perfect that way. So you're always going to get a little bit more at the beginning, and it's going to taper off towards the end, and then you change it and you get a fresh patch, and you get a little bolus of estrogen. And I think that's probably what you're experiencing there, is that when you put the new patch on, you get this little extra little bit of estrogen that's giving you these estrogen side effects. And so that all makes sense. So there's a couple of strategies for this. One would be to lower the strength of the patch, and it might blunt this, and it may still be enough to keep your symptoms under control. So this may be one sign that the patch may be just an incy bit too strong for you. The other would be to switch to a cream, because there's less of this effect with a cream, because you're using it daily rather than every 2 to 3 days. So you get less of this bolus effect, and you get a little bit better of a steady state, which is a little counterintuitive. I hear people thinking, the patch is going to give me a better steady state. Hasn't been my experience. I think the cream does a better job of that than the patch does. And what you're describing sounds like exactly that problem. So the two strategies would be to decrease the strength of the patch, and that may be the right thing to do for you. The other way to go would be to switch to a cream and see if that gives you a little bit smoother sort of day-to-day estrogen level.
Okay, so the next one is, wicked migraines since I started perimenopause. Will this at least help relieve some of those symptoms too?
For some women with migraines, this is really good dynamite for it. Works great. And so some women get migraines from a sudden drop or sudden change in estrogen levels. So if you're one of these people that would get migraines right before your periods, started, this tends to really help those migraines because it levels off that estrogen and keeps those rapid ups and downs from coming, which tends to trigger migraines. Other people get migraines for completely other reasons, and this isn't really going to touch those. It should not make them worse, and it's safe to use if you have migraines. But for some people, it really helps, and for others, it doesn't do much, and it sort of depends on what's triggering those migraines.
The next question. Acne. I'm experiencing an increase in acne now. I have not started treatment yet. I'm hoping it doesn't get worse.
So it probably won't. This can help with acne, again, by leveling out the hormone levels. And it really shouldn't make acne worse. Every once in a while, it's pretty unusual, but people, everyone's different. And every once in a while, we have somebody where it does worsen the acne. But usually, at least after that first month, the acne tends to mellow out and actually get better.
All right. And the next one is the vaginal estrogen something you can prescribe?
Absolutely. So yes, we have a vaginal estrogen that's compounded in our pharmacy that works really well. So that is something that we can prescribe for you.
Okay. Next one. Thank you so much. I appreciate having a real doc and having your time with us. Oh.
Thanks.
The next one is, I'm new to this and I've been using the estrogen cream and DHEA for a little over 2 weeks now. Will this help with my hair fallout?
So the estrogen, the estrogen cream can help make the hair thicker and healthier, and decrease some of that hair loss. But it depends on why you're having hair loss. So, and this is something that sometimes people don't understand, but there are a lot of reasons for hair loss. The perimenopause is one of those, and this will help that. But there are other reasons for hair loss as well. And so if you're having some other, dermatitis, this isn't necessarily going to fix that. So it shouldn't make it worse. It may make it better. And if it doesn't, then ultimately you want to see a dermatologist so that seeing what is the underlying cause of the hair loss? Is there something else you need to do to help with that?
Okay. So the next one is, I started my HRT and didn't know I had COVID. I got very sick and thought it was the HRT and canceled my account. After getting over COVID, I resumed HRT. Can I reactivate my account again if I do well?
Absolutely. Yeah, just send us a message, and you don't have to go through all the onboarding it or anything. Just send a message to me or whoever your doctor is, and let them know that you'd like to get represcribed. Let them know if there's been any changes in your medical condition that we'd like to know, and we'll get you restarted. Yeah, it's funny. Every now and then I get somebody, they message me with these symptoms that are clearly not from HRT, but it's like, you better get a COVID test, or, gosh, it sounds like you ate something bad, or what have you. So, it's normal. You start a new medicine and then something goes wrong and you're going to blame the new medicine. But, we do get other things. And COVID also, just FYI, can really mess with your periods. So that's the other thing that I've seen. I've been actually really surprised. I was having a conversation with the doctor about this yesterday, this morning, that COVID really seems to sort of mess with menses. Don't really understand why, but it's pretty common. There's actually been some papers on that as well. But anyway, a little aside.
Okay, so the next one is, any noticeable difference between the 50/50 cream versus the equivalent patches?
I'm sorry, say that again. I missed that one.
Any noticeable difference between the 50/50 cream versus equivalent patches?
So again, it's one of these things where it's different for different people. I think for the vast majority of people, they both work really well. They each bring with it their own benefits. So the patch, for some people, they like it because they only have to remember to do it a couple times a week. And it's not an everyday thing. But for other people, it's annoying to have to wear a patch all the time. The other thing is the patch is a lot more expensive than the cream, because the cream we make ourselves in our pharmacy, and so we can keep costs that way. That's an advantage of the cream, is that it's less expensive. It goes back to my menu restaurant thing. But they both work well, and advantages are more personal preference than sort of medical. Although again, every now and then I have somebody who seems to not respond to one type and responds better to the other, and that's a little bit of trial and error.
I've been experiencing, okay, I'm sorry, here's the next one. I have the same question as Maria regarding the cream and DHEA pills helping with hair loss. I've been experiencing it since having the Mirena IUD inserted. I had it removed months later, but had the same effects, such as hair loss. I have low estrogen, high cortisol, with normal progesterone and testosterone. Also, should I take the cream DHEA at PM or AM? I'm 45.
Okay, so much stuff in that question. Let's start with the easy one. For most people, the cream works best at night, and the DHEA doesn't seem to matter when they take it. A very small percentage of people, the cream does the opposite, and it keeps them up at night. And for rare people, it'll give them crazy dreams. I know this has showed up on our Facebook group a little bit. It's pretty rare, but it can happen. And in that case, the fix is take it in the morning. So the vast majority of people, the cream is best at night, but every now and then you have somebody that does better with it in the morning. It's totally okay to experiment around different times a day and see what works best for you, because everybody's different. The DHEA, it's pretty unusual to find a big preference for morning or evening. Although just today, someone told me that they were taking it in the morning and it was causing them problems, and they took it at night, and it's like the greatest thing since sliced bread. So again, it's okay to experiment with different times of day and see what works best with you. So the first part of that question is with hair loss, we sort of talked about that. The hormone replacement therapy should improve hair health and hair thickness. There is some stuff out there about DHEA causing the male pattern baldness, but again, that's in these giant doses that are used to try to really push the testosterone levels into, male levels rather than female levels. And so we don't do that. So at the 25 to 50 milligrams of DHEA, it really should not cause male pattern hair loss, and it shouldn't cause hair problems. The cream for most people increases hair health and hair thickness, but again, there's lots of reasons that people lose hair, and some of them don't have anything to do with the hormones. It should help it should help with the hair loss, but it doesn't always, because sometimes that's not the reason for the hair loss itself. And the last part, I don't know, I want to get too far into this because of the time, but tests for hormone levels honestly are pretty useless. They're great for thyroid, but for estrogen, progesterone, testosterone, they're not very helpful because they change like throughout the day. It depends what time of day they're drawn, depends what time in your cycle they're drawn. It can depend on what you've eaten recently. They really vary a lot, and these blood tests just aren't very useful at all. And so hormone replacement therapy is really based on symptoms. That's telling me, your body is going to tell me a lot more than, Quest Diagnostic or wherever you're getting your hormone tests, as far as what your hormone replacement needs are going to be. I think I picked up most of those things.
So Jennifer actually wrote in and said, thank you for the response regarding my crazy bedridden periods. Saw 4 different doctors and they all said typical perimenopause side effects, and it will go away eventually, hopefully within the next few years. Oh, well.
I'm sorry.
Yeah, I know.
I'm sorry. I mean, on behalf of the medical profession, I apologize. That's not very good. Because, and you know what? I don't know. Maybe they did an exam and a workup and they really felt that's the truth. In that case, if they're right, then hormone replacement therapy is going to help you. I just think usually there's other ways to go about it. But if you've already seen 4 docs, give it a try. You don't really have much to lose, and hopefully it'll help. But I think when somebody's got something that's so bad it's keeping them bedridden for periods of time, to say, oh, well, this will get better someday. I don't know. I guess it's not fair for me to bag on other doctors. But it's like, gee, we need to look a little deeper and try and figure this out for you.
So the next question is, I'm getting ready to start my estrogen progesterone cream in DHEA, waiting for my shipment to arrive. I looked up my past medical records and I found in 2006, I was founded to have 2 copies of the 4G ally, in the PAI1 gene. I don't have other clotting problems that they have tested for. Should I worry about taking HRT? Anything I should look out for? Thank you.
So I got to be honest with you. This is one I would have to look up because I'm not familiar with that specific gene defect. So if I'm your doctor, will you please message me with that, and I will do the homework and figure that out for you. If it's one of my colleagues, message them and ask them that question. But that's a lookup thing. So we try and carry as much stuff in our brain as we can, but there's only so much capacity there. What we do know how to do is to look stuff up in a, it's different than asking Dr. Google. Like part of what we get in medical school and residency is learning how to look things up properly, so that we find scientifically appropriate studies and articles and textbooks. So I can research that for you. But whoever else is taking care of you, we can research that for you and make sure that this is going to be safe. The last thing we want to do is cause a problem. So please message whoever is your physician in the chat function in the patient portal, and we'll do the research and figure that out for you.
So the next one is from Lisa. She says, I'm feeling very sleepy and have a hard time getting up in the morning. I'm in cream at night and DHEA in the morning. I've been on this for 2 weeks.
So you're one of these people that I'm going to tell you to experiment around with different times of the day. So try the DHEA at night. It's possible the DHEA is making you sleepy. It's unusual, but it can happen. So it might be that you're taking that DHEA in the morning and it's making you drowsy during the day. If that doesn't work, try moving the cream either to the morning or try moving it a little bit earlier in the evening and seeing if that helps. But I think it's going to be a timing issue, and try and figure out, for your particular situation in your body, what works best for you. And it's totally okay to experiment around that way until you figure out what's going to be best for your situation.
So the next one is, sorry, my computer screen freaked out a little bit. Claudia said, I'm also feeling very sleepy since I started HRT. It's only been 3 weeks. Is this normal?
So yeah, kind of the same answer is try taking it at different times and seeing if that helps. Usually that's really what the issue is. Occasionally, 3 weeks, you're sort of getting there. Usually by 4 or 5 weeks, any of these sort of initial things are going away. So it may just be a transition period for your body. But I think, again, trying different times of the day is going to be the way to go on that.
So this isn't a question, but it's such a great comment. I wanted to read it out loud for you, Dr. Green. I love this about Dr. Green. Many in the BHRT arena and all our supplement and natural everything. The MD world does not endorse BHRT. I feel like Winona balances the best of both worlds. And this webinar has made me even more at peace with my decision to trust you. BHRT, bravo.
Well, thank you. I try to do my best. It's the golden rule, right? Treat people like you want to be treated.
So I believe that was all of our questions that were written in. We did have one more from a patient before the webinar that wasn't able to attend that I promised her I would read. So I'll read that really quickly and then that should be it. What do you think about progesterone pills being used vaginally? A lot of the European bioidentical versions of progesterone can be used both orally and vaginally. This is especially preferred by women who want to bypass their liver. Second question, if Winona's version of the progesterone pill cannot be used vaginally, what do you recommend for women with elevated liver enzymes after using the pill version?
Okay, so let's tackle the liver enzyme thing first. So no matter how you use the medicines, if they're getting into your bloodstream, they're eventually getting metabolized by the liver. Bypassing the stomach and the intestine decreases that effect. And the reason is that when you take something by mouth, it gets absorbed into the veins, and the first place it goes, the whole sort of brunt of it goes to the liver. And then most of it escapes that and gets into circulation. But so the liver gets this big amount of stuff all at once. And it's a little bit harder on the liver. The creams, whether they're absorbed through the skin or through the vagina, if they get into the blood system, then they do eventually get to the liver, but they go through all the body first. And so they don't hit the liver in this one big dose. And so they're more gentle on the liver. But whether you take this through your skin or through your vaginal mucosa, it's still going to get to the liver. So there's really not going to be, I'll preface this in a minute, but there's not going to be any difference between transdermal through the skin and vaginal through the vaginal mucosa in the effect on the liver, assuming it's getting into the blood system. And the reason I say that is that estrogen vaginal cream actually doesn't get absorbed to the same extent that the transdermal cream, the cream on your regular body skin, does. And that's why, number one, it doesn't give benefit to all these systemic problems like your hot flushes and that kind of stuff, but it does a lot of vaginal benefit. But the bonus about it is, even if you have a uterus, it's safe to use just estrogen vaginal cream without using progesterone, because it's not going to affect the uterus the way transdermal or a pill cream will work, because it doesn't really get into the blood system. And so in that way, it's going to be much safer on your liver, because it's not really getting there to any great extent to be metabolized by the liver. But it also means it's not working systemically. The same thing is going to be true with progesterone. So if the progesterone is going to just be working locally on the vagina, yeah, it's going to be better for your liver, but it's not going to project your uterus, and it's not going to help your other progesterone symptoms. So I don't see any, and the vaginal changes don't really respond to the progesterone. So if we're working on treating your vaginal symptoms and you want to use a cream or use a vaginal preparation, it's the estrogen cream that's really going to help. The progesterone cream doesn't really do that, and it doesn't give you vaginal health. We do use progesterone creams in infertility, but that's really a completely separate issue that doesn't really help you in the perimenopause. So I see really no benefit or reason to use a progesterone vaginal cream. It's not gonna, if you're using it the way we usually use progesterone, which is mostly to protect your uterus and some for sleep and mood stabilizing benefit, it's not going to give you any of that. Sure, it's not going to hurt your liver, but it's not going to do anything. So why use it at all? So I don't really understand a logical reason outside of infertility world to use, for perimenopausal symptoms, to use progesterone vaginally. Is it going to hurt you? Probably not. Is it going to help you? Probably not. So again, why go through the expense and the hassle and really the risk of adding a medication that's not going to particularly help you? Sorry, what was the first part of the question?
The first part was, what do you think about progesterone pills being used vaginally? A lot of European bioidentical versions of progesterone are used both orally and vaginally.
So yeah, I just don't think it's useful. I just don't understand. I hesitate to say this, but it's the truth. Unfortunately, there's a lot of gimmicky stuff out there where people will do things that get some rest. People will do things that don't really help, but they sound like they should, and people like them, and they can make money off of them, and so they do that. And it's just not the way I am. It's like, if I'm going to give you something, I expect it to work, and I expect it to give you benefit. But honestly, I've got patients that want to try something that is safe. I'm not sure it's going to work, and I'll tell them, gee, I'm not sure it's going to work for you. It's safe, and if you want to try it, then let's try it together and see, because I don't know everything. But just from a scientific, physiologic understanding, I don't see really a benefit to using progesterone vaginal suppositories or cream for perimenopause symptoms.
Okay, well, that was officially our last question, but Kathy did say thank you, Dr. Green. We appreciate your practical approach.
My pleasure, and welcome to the Winona family. I really hope this is helping you guys. That's what this is all about. And please don't hesitate to ask these questions to me or to your doctor. That's what the portal's for, and we're very happy to answer your questions. Educated patients are great patients, and I like when people ask me even difficult questions, because it means they're more engaged and they're really interested in their health. So that's great.
So before we end, I just wanted to let everyone know that I did put a link to join our Winona Women Facebook community. And Lisa, to answer your question, we do post the recorded version in there along with our YouTube. You can find all of our previous webinars and some bonus videos that Dr. Green has done on his own time.
Oh, let me say one more thing real quick. Facebook group is great. It's really helpful to get on there and talk to other women that are going through the same thing as you. Just the one little caveat, there's a certain kind of people that tend to be on social media. And so there are some things that end up being kicked around the Facebook group that, a couple of individuals have. The Crazy Dreams is one of them I know was kind of being kicked around for a while. And yeah, I've seen it a couple of times. So it can happen, but it's pretty darn rare. But, if it happens to you, you're going to get on the Facebook group and tell everybody. So it's a great place to be. Totally encourage you to go there. But again, remember that just because one person had some side effect doesn't mean that you're going to get it, or that necessarily it's a really common side effect. So hope that's okay.
Yeah, that's great. Well, thank you all for attending so much. We host these webinars once a month. If you want the link to sign up for the next one to pre-register, you can go to our Instagram. There's a link in bio where you'll find a button that says attend a live Q&A. You can register there for the next month. And I believe since you're here this month, you also might get an email notification for the next month's one as well. But thank you all. It's been so great having all of you.
Yeah, thanks for coming. See you next month.
Bye.
Bye.